I'm about to reveal something that might save your life. Right now, while you're watching this video, there's a pill sitting in your medicine cabinet. A pill you probably took this morning. A pill your doctor prescribed. A pill that millions of seniors take every single day. And this pill is slowly, silently, irreversibly destroying your heart. Not damaging it, destroying it. And you won't feel it happening until the day you collapse. I'm Dr. Claire Whitmore, and after 2 decades as a cardiac surgeon, I've held hearts in my hands that were destroyed by this medication. Hearts that should have been healthy. Hearts that were working perfectly fine until this pill started the damage. And here's what terrifies me. Here's what keeps me up at night. Every single patient I ask says the same thing. My doctor said this pill was safe. My doctor said I needed it. My doctor never told me it would destroy my heart. But I'm not going to tell you which pill it is yet. Because if I just give you the name right now, you'll check your medicine cabinet. And if you're not taking that specific pill, you'll stop watching. You'll think you're safe, but you're not safe. Because there are 6 other medications, 6, that destroy hearts in seniors the exact same way. And I'm going to reveal all 7 before this video ends. But first, you need to see what this destruction looks like. You need to understand what's happening inside your chest right now if you're taking any of these pills. Let me tell you about William. William was 72 years old, retired postal worker, healthy his whole life. Never smoked, never drank excessively, good weight, exercised regularly. But William had arthritis, bad arthritis in his knees, the kind that makes every step painful, makes getting out of bed in the morning an ordeal, makes you wince just walking to the mailbox. His doctor said, "William, I'm going to prescribe you something for the pain. It'll help you move better, help you stay active. That's important at your age." The doctor prescribed William a common medication, the kind you've heard of, the kind that's advertised on TV, the kind that 60 million Americans take, the kind sitting in medicine cabinets across the country right now. William took it exactly as prescribed, twice daily. Every single day. And it worked. The pain decreased. His knees felt better. He could walk without wincing, could garden again, could play with his grandchildren. For 3 years, William took this medication faithfully, never missed a dose, did exactly what his doctor told him. But something was happening inside William's chest. Something he couldn't feel. Something that didn't hurt. Something invisible, silent, deadly. The medication was forcing his heart to work harder, much harder. Every single beat required more effort than it should. His blood vessels were constricting slightly. His blood pressure was rising. His kidneys were retaining fluid. And his heart, his poor heart, was struggling to keep up. Month after month, year after year. The heart muscle was straining, overworking, like a runner sprinting a marathon instead of jogging. At first, William's heart compensated. It's an amazing organ. It can adapt. It can work harder when needed. But there's a limit. There's a breaking point. And William's heart was approaching that point without anyone knowing. Not William, not his doctor, no one. The first sign was subtle. William noticed he got tired more easily. Walking up his driveway left him a bit winded. He thought it was age, just getting older. Everyone gets tired, right? He didn't mention it to his doctor. Didn't seem important. Just normal aging. But it wasn't normal. His heart was failing. The muscle was weakening, losing its ability to pump effectively. The damage was accumulating. Irreversible changes were occurring in the heart tissue. Then William started waking up at night. Had to sleep with 2 pillows instead of 1. Lying flat made him feel like he couldn't breathe, like there was weight on his chest. Like he was drowning. He'd wake up gasping, sit up, wait for the feeling to pass. This happened 2, 3, 4 times a night. His sleep was destroyed. He was exhausted during the day. But he still didn't connect it to his heart. Thought maybe it was sleep apnea, maybe acid reflux. Never thought it was his heart. Why would he? He was taking medication for his knees. What did that have to do with his heart? But here's what was actually happening. And this is the part that should terrify you. This is the part your doctor never explained. William's heart was filling with fluid. The weakened muscle couldn't pump blood forward efficiently. Blood backed up into his lungs. Fluid leaked from blood vessels into lung tissue. Every night when William lay flat, gravity allowed this fluid to spread throughout his lungs. He was literally drowning in his own fluid. That's why he couldn't breathe. That's why he had to sit up. His lungs were filling with fluid every single night. And the medication he was taking, the medication for his knee pain, was making it worse. Every dose forced his heart to work harder against increased resistance. Every dose retained more sodium, more fluid. Every dose pushed his failing heart closer to complete collapse. And nobody knew. Nobody was monitoring. Nobody was checking his heart function. Because nobody thought a medication for knee pain could destroy a heart. Then came the day everything changed. William was in his garage, working on his car. Normal Saturday morning. He stood up from under the hood, felt dizzy, sat down on his workbench, waited for it to pass. But the dizziness got worse. His vision started narrowing, tunneling, going dark around the edges. He tried to call for his wife, but no sound came out. His wife found him slumped over, unconscious, called 911. In the ambulance, the paramedics couldn't get his blood pressure above 80 systolic. His oxygen saturation was 78%. Should be above 95%. His lungs were full of fluid. They could hear it, crackling sounds with every breath. Rails. The sound of drowning. They put an oxygen mask on him, started an IV, gave him medication to remove fluid, rushed him to the hospital. The ER doctor took one look at the chest X-ray and knew. Heart failure. Severe heart failure. William's heart was barely pumping. His ejection fraction, the measure of how much blood the heart pumps with each beat, was 25%. It should be 55 to 60%. His heart was pumping less than half of what it should. The muscle was enlarged, dilated, weak, scarred. Years of damage visible on the echocardiogram. The cardiologist showed William's wife the images. See how the heart barely squeezes? See how thin and stretched the muscle is? This is advanced heart failure. His heart is destroyed. And here's the moment that breaks my heart every time I think about it. The moment that made me film this video. The moment that makes me furious at a medical system that allows this to happen. The cardiologist asked William's wife, "What medications is he taking?" She listed them. And when she said the arthritis medication, the cardiologist stopped her. "How long has he been on that?" 3 years. The cardiologist closed his eyes, shook his head. "That medication causes heart failure. We've known this for years. There are black box warnings on it. Your husband should never have been on it for 3 years. His heart is destroyed because of that medication." William's wife started crying. Not just tears, sobbing. The kind of crying that comes from rage and grief mixed together. Nobody told us. His doctor never said anything about his heart. Never checked his heart. Just kept refilling the prescription. Kept saying it was safe. How could this happen? The cardiologist had no answer. Because there is no good answer. This happens every single day. Across the country, across the world. Doctors prescribe medications without considering the cardiac effects, without monitoring, without warning. And hearts get destroyed. But here's what makes William's story even more devastating. Are you ready for this? Because this is going to make you angry. This is going to make you want to throw something. William's arthritis could have been treated differently. There were safer options. Acetaminophen, topical creams, physical therapy, cortisone injections. A dozen alternatives that wouldn't have destroyed his heart. But his doctor went straight to the pill that's easiest to prescribe. The pill that drug companies promote. The pill with the highest profit margin. And that pill destroyed William's heart. Now William is 75, lives with severe heart failure, takes 7 cardiac medications every day, can't walk up a flight of stairs without stopping, can't carry groceries, can't do the things he loved. His garage, where he used to work on cars, sits empty. He doesn't have the energy anymore. His grandchildren come to visit, and he can't play with them, can't pick them up, can barely stay awake for their visits. His life has been reduced to sitting in a recliner, struggling to breathe, waiting for the next hospitalization. Because heart failure doesn't get better. It only gets worse. And William's heart is so damaged that he's not a candidate for transplant. Too old. Too much damage. This is permanent. And every single day, William looks at his wife with tears in his eyes and says, "Why didn't anyone tell me? Why didn't my doctor warn me? I would have just dealt with the knee pain. I would have done anything rather than this, rather than not being able to breathe, rather than feeling like I'm drowning every night, rather than being trapped in this useless body." Now I need you to stop for a second. I need you to really think about what I just told you. William was healthy, active, independent, living a full life. And one medication prescribed for knee pain destroyed all of that. Took his independence, took his quality of life, took his future. And he's not alone. This is happening to thousands of seniors right now. Today, while you're watching this video. But here's what I haven't told you yet. Here's the part that's even more terrifying. The medication that destroyed William's heart? You've probably heard of it. You might be taking it right now, or your spouse is taking it, or your parent. It's in 40% of medicine cabinets in America. 40%. That means if you know 10 people over 65, 4 of them are probably taking this medication, and their hearts are being destroyed right now. Silently, without symptoms, until the day they collapse like William did. And I'm still not going to tell you the name yet, because William's story is just one of 7 I need to tell you. 7 different medications, 7 different ways hearts get destroyed, 7 different patients whose doctors said the medication was safe. And all 7 medications are commonly prescribed to seniors. All 7 are considered routine. All 7 are destroying hearts right now. But before I tell you the second story, I need to tell you something else about William's heart. Something the cardiologist found when he looked closely at the damage. Something that explains why this medication is so deadly for seniors specifically. Something that shows why what was safe at age 50 becomes deadly at age 70. When you're young, your heart has reserve capacity. It's like having a car engine that can rev to 7,000 RPM, but you normally only use 3,000. You have extra, buffer, protection. But as you age, that reserve disappears. By age 70, you're using most of your heart's capacity just for normal daily activities. There's no buffer left, no protection. So when a medication forces your heart to work harder, even just 10 or 15% harder, there's no reserve to draw from. The heart fails, immediately, catastrophically. William's heart had no reserve left. At 72, he was using 90% of his cardiac capacity, just living normally. When the medication forced his heart to work 15% harder, he needed 105% capacity. But you can't exceed 100%. The heart can't give more than it has. So it failed. The muscle stretched, dilated, weakened, permanent damage. And this same process is happening right now in millions of seniors taking this medication. Hearts stretched to their limit. One medication away from failure. One prescription away from William's fate. Now let me tell you about Dorothy, because Dorothy's story shows what happens when the damage is even worse. When the medication doesn't just cause heart failure, when it actually kills parts of the heart muscle, when it creates permanent dead zones that can never recover. Dorothy was 68 years old, had high blood pressure, nothing severe, just 142/88. Her doctor wanted to get it under control. Said, "Dorothy, high blood pressure is dangerous. We need to lower it. I'm going to start you on medication." Dorothy agreed. Of course she agreed. High blood pressure is bad. Everyone knows that. You should lower it. That's what doctors always say. The doctor prescribed Dorothy a blood pressure medication, a common one of the most prescribed in the entire country. Dorothy took it faithfully, every single morning, never missed. Her blood pressure came down beautifully, 128/78, perfect numbers. Her doctor was pleased. "Keep taking it, Dorothy. It's working great." Dorothy felt proud. She was taking care of her health, doing everything right, following doctor's orders, being a good patient. But inside Dorothy's chest, something terrible was beginning. Something nobody could see. Something that wouldn't show up on a blood pressure cuff. The medication was affecting her heart muscle directly. Specifically, it was affecting the calcium channels in her heart cells. These channels control how the heart muscle contracts. When they're blocked by medication, the contractions weaken. The muscle doesn't squeeze as hard. And over time, over months and years of weakened contractions, the muscle begins to change. At first, the changes were microscopic. Individual heart cells struggling, working harder to compensate for the blocked calcium channels. But cells have limits, and when you push them beyond those limits day after day, month after month, they don't just get tired, they die. And when heart muscle cells die, they don't regenerate. They're replaced by scar tissue, non-functioning tissue, dead zones in your heart. For 4 years, Dorothy took this medication. 4 years of her heart cells dying slowly. 4 years of scar tissue accumulating. 4 years of her heart muscle being replaced bit by bit with useless fibrous tissue that can't contract, can't pump, can't do anything except take up space where functional muscle used to be. And Dorothy felt fine. That's what makes this so insidious, so evil. You don't feel your heart cells dying. There's no pain, no warning. Your heart compensates. The remaining healthy cells work harder, pump faster, maintain blood flow. You feel normal. Meanwhile, your heart is being destroyed from the inside out, cell by cell, beat by beat, silently. Then Dorothy started feeling tired, exhausted, all the time. She thought it was her age, just getting older. Maybe she needed vitamins. Maybe she wasn't sleeping well. She mentioned it to her doctor. The doctor ordered blood work, checked her thyroid, checked for anemia. Everything came back normal. You're fine, Dorothy, just aging. Maybe try to exercise more. That'll help with energy. But exercise made it worse. Dorothy would try to walk around her neighborhood. Used to walk 2 miles easily. Now, she couldn't make it halfway around the block without needing to sit down. Her legs felt heavy. Her breathing was labored. Her heart was pounding. She felt like she was going to pass out. She stopped trying to exercise, thought maybe she was just too old for that anymore, accepted that her active days were behind her. What was actually happening? Dorothy's heart was failing. The years of calcium channel blockade had killed so much heart muscle that the remaining muscle couldn't maintain adequate cardiac output. Her heart was pumping, yes, but not effectively. Not enough blood was reaching her muscles, her brain, her organs. Everything was starving for oxygen. And the exertion of walking revealed this. Her dying heart couldn't keep up with even mild exercise demands. Then one day, Dorothy was at the grocery store, walking down an aisle, reaching for something on a shelf. She felt a strange sensation. Not pain, just strange. A fluttering in her chest, a sense of something wrong. She stood still, waited for it to pass. But it got worse. The fluttering became stronger. Her heart was racing, pounding. She felt lightheaded, dizzy. The room started spinning. She grabbed the shelf to steady herself, tried to call for help. But before she could speak, her legs gave out. She collapsed, hit her head on the floor, lost consciousness. Other shoppers saw her fall, called 911. Paramedics arrived, found Dorothy unconscious. Her heart rate was 180, dangerously fast, irregular, chaotic, atrial fibrillation. Her heart's upper chambers were quivering instead of beating, blood pooling instead of flowing, clots forming. The paramedics started an IV, gave medication to slow her heart, put her on oxygen, rushed her to the hospital. In the ER, they did an echocardiogram. What they found shocked everyone. Dorothy's left ventricle, the main pumping chamber, was barely moving, barely contracting. The walls of the chamber were thin, dilated, stretched out like a balloon blown up too big. And throughout the muscle, they could see areas that weren't moving at all. Dead zones, scar tissue. Places where the muscle had died and been replaced by fibrous tissue that can't contract. The ejection fraction was 30%, should be 55 to 60. Dorothy's heart was pumping less than half of what it should. The cardiologist came in, sat down with Dorothy and her daughter, showed them the images. Dorothy, you have severe dilated cardiomyopathy. Your heart muscle has been damaged, extensive damage. The muscle is weak, thin, not functioning properly. This is why you've been so tired, why you collapsed today. Your heart can't pump enough blood to sustain you. Dorothy was crying. How did this happen? I don't understand. I've been healthy. I take my medications. I've been doing everything right. The cardiologist looked at her medication list, saw the calcium channel blocker, asked, "How long have you been on this?" 4 years. The cardiologist's face fell. This medication can cause cardiomyopathy in some patients, especially in older adults. It blocks calcium channels in the heart muscle. Over time, this can cause progressive muscle damage. In some people, the damage is mild. In others, like you, it's severe. Dorothy couldn't believe it. My doctor never told me this medication could damage my heart. Never mentioned it. Just said it was for my blood pressure. Said it was safe. The cardiologist said, "It is safe for most people, but not everyone. Some people are genetically susceptible to this side effect, and we don't always know who those people are until the damage happens. That's why we're supposed to monitor heart function in patients on this medication long term." Did your doctor ever check your heart function? Never. Not once in 4 years. And now Dorothy's heart is permanently damaged, irreversibly damaged. She stopped the calcium channel blocker immediately, but the damage was done. The dead heart muscle doesn't come back. The scar tissue doesn't turn back into functional muscle. Dorothy is 68 years old, with the heart function of someone dying from end-stage heart failure. She needs a heart transplant to survive long-term. But at 68, she's too old, not a candidate. This is how she'll live for whatever years remain. Severe heart failure, barely able to function, trapped in a body that can't keep up with even the simplest activities. And the medication that did this? The medication that killed parts of Dorothy's heart muscle? It's still being prescribed. Right now, today, to thousands of seniors, many of whom will develop the same cardiomyopathy, the same permanent damage, the same irreversible heart failure. Because doctors keep prescribing it without monitoring, without checking heart function, without warning patients of the risk. Now think about this. Really think about it. Dorothy went to her doctor for high blood pressure, 142/88, mild elevation. Could have been managed with diet and exercise. Could have been treated with safer medications. Could have been left alone and she would have been fine. But instead, she was given a medication that destroyed her heart, killed her heart muscle, created permanent disability, ruined the rest of her life, all to lower her blood pressure by 14 points. Was it worth it? Was 14 points of blood pressure reduction worth destroying Dorothy's heart? Worth stealing her independence? Worth making her last years a struggle to breathe? Of course not. But this trade happens every day. Doctors prescribe medications without considering the full cost, without weighing the risks against the benefits, without thinking about what happens when the treatment is worse than the disease. And I'm still not telling you which medication this is. Not yet. Because you need to understand something else first. Something critical. These medications aren't dangerous for everyone. Some people take them for years with no problems, no side effects, no heart damage. But some people, and we don't always know who, are devastatingly susceptible. Their hearts are destroyed by medications that other people tolerate fine. And the only way to know which group you're in is to monitor. Check heart function regularly. Watch for early signs of damage. But that monitoring doesn't happen. Doctors prescribe and forget. Are you starting to feel worried? You should be. Because if you're over 65 and taking any medications, blood pressure medications, pain medications, diabetes medications, heart medications, there's a chance they're damaging your heart right now, and you won't know until it's too late. Until you collapse like William, until your heart muscle dies like Dorothy's, until the damage is permanent and irreversible. But here's what I'm going to do. Before this video ends, I'm going to tell you exactly which medications are the most dangerous. I'm going to give you the names, the doses, the warning signs, everything you need to protect yourself. But you need to keep watching, because if you leave now, if you think you've heard enough, you might miss the medication you're actually taking. You might miss the one that's destroying your heart right now. Let me tell you about James. Because James's story shows yet another way medications destroy hearts in seniors. A way that's even more insidious, even more unexpected, even more common. James was 76 years old, had acid reflux, bad reflux, heartburn every night, burning in his chest, acid coming up into his throat, affecting his sleep, his quality of life. His doctor said, "James, I'm going to put you on a proton pump inhibitor. It'll reduce your stomach acid, get rid of the heartburn. You'll feel much better." James was grateful, started taking it. The heartburn disappeared immediately, like magic. No more burning, no more discomfort. James was thrilled. Took this medication every morning for 8 years. Never had heartburn again. But inside James's body, something was going wrong. The medication was blocking acid production in his stomach. That was the goal. That's what it was supposed to do. But here's what nobody told James. Here's what his doctor either didn't know or didn't think was important. When you block stomach acid long-term, you block the absorption of critical nutrients, specifically magnesium. And magnesium is absolutely essential for heart rhythm. Every heartbeat is controlled by electrical signals. These signals depend on the balance of electrolytes: sodium, potassium, calcium, magnesium. When magnesium drops too low, the electrical system becomes unstable. The heart starts misfiring, beating irregularly, chaotically. And James's magnesium was dropping, slowly, month by month, year by year. The proton pump inhibitor was blocking its absorption. His body's stores were being depleted, and nobody was checking. Nobody was monitoring his magnesium level. For 8 years, James took this medication. For 8 years, his magnesium dropped. Until one day, it reached a critical threshold, the level where heart rhythm becomes dangerously unstable. James was at home, watching TV. Normal evening. Suddenly, his heart started racing. Fast, irregular, pounding in his chest. He could feel it, like a fish flopping around inside his ribcage. Skipping beats, racing, fluttering. He stood up, felt dizzy, sat back down, tried to calm down, thought maybe it was anxiety. But it didn't stop. His wife called 911. Paramedics arrived, did an EKG, atrial fibrillation, AFib. The heart's upper chambers quivering at 300 to 400 times per minute, instead of beating normally at 60 to 80. This creates terrible consequences. Blood pools in the quivering chambers. Clots can form. These clots can break loose, travel to the brain, cause massive strokes. James needed treatment immediately. They rushed him to the hospital, started blood thinners, gave medication to control his heart rate, tried to convert him back to normal rhythm. But the AFib persisted, day after day, week after week. His heart wouldn't go back to normal. The cardiologist was puzzled. James had no risk factors for AFib. No high blood pressure, no heart disease, no hyperthyroidism, no sleep apnea. Why did he develop AFib? The cardiologist did comprehensive blood work, found James's magnesium was 1.2, should be above 2.0, critically low. James, your magnesium is dangerously low. This is why you have AFib. Low magnesium destabilizes heart rhythm. Why is your magnesium so low? They investigated, found the 8 years of proton pump inhibitor use. That was the cause. The medication had been blocking magnesium absorption for years, slowly depleting James's body, until his heart rhythm failed. They stopped the PPI immediately, started high-dose magnesium supplementation. James's magnesium level came back up over weeks, but the AFib persisted. Because here's the devastating reality about AFib. Once it starts, it often doesn't stop, even if you fix the underlying cause. The heart muscle has remodeled. The electrical pathways have changed. The atrial tissue has been damaged by the chaotic rhythm. AFib becomes permanent, self-sustaining, irreversible. James is 80 now, still in AFib. Permanent AFib. He'll be an AFib for the rest of his life. He's on blood thinners forever. Risk of stroke permanently elevated. Risk of heart failure increasing every year. All because he took a medication for 8 years to prevent heartburn. A medication that slowly depleted his magnesium. A medication that destroyed his heart rhythm. A medication his doctor never thought to monitor. And the worst part? James didn't even need that medication long-term. Acidic reflux can be managed with diet, with weight loss, with elevating the head of the bed, with antacids as needed. But James's doctor went straight to the strongest medication, the proton pump inhibitor, meant for short-term use, 4 to 8 weeks, not 8 years. But doctors prescribe them long-term routinely. Millions of seniors are on them indefinitely. And their magnesium levels are dropping. Their heart rhythms are becoming unstable. AFib is developing. Stroke risk is rising. All preventable. All unnecessary. Now I've told you 3 stories. William with heart failure from his pain medication. Dorothy with dead heart muscle from her blood pressure medication. James with permanent AFib from his reflux medication. 3 different medications, 3 different mechanisms of damage, all destroying hearts, all commonly prescribed, all considered safe by doctors who don't monitor, who don't warn, who don't think about the cardiac consequences. And you're probably screaming at your screen right now, "Tell me which medications! Stop torturing me! I need to know!" And I'm going to tell you, very soon. But first you need to understand one more thing. One critical piece that explains why this keeps happening. Why doctors keep prescribing these medications despite the cardiac risks. Why the medical system fails seniors over and over again. The reason is this. The studies that approved these medications didn't include enough elderly patients. Most drug trials exclude people over 70, sometimes over 65, because elderly patients are complicated. They have multiple health conditions. They take multiple medications. They're hard to study. So drug companies test their medications on healthy 50-year-olds, find the medications are safe in 50-year-olds, get FDA approval based on 50-year-old data. Then, doctors prescribe these same medications to 75-year-olds, and nobody knows if they're safe in 75-year-olds, because nobody studied them in 75-year-olds. William's medication was studied in people aged 40 to 65, average age 52. Showed minimal cardiac effects in that age group. Got approved. Now prescribed to millions of people over 70. And their hearts are failing. Dorothy's medication was studied in healthy adults, average age 48. Showed rare cardiomyopathy, less than 1%. Got approved with a warning label. Now prescribed to people in their 70s whose hearts have less reserve. And the cardiomyopathy rate is 5 to 10%, 10 times higher. But nobody's tracking this. Nobody's reporting it. Nobody knows. James's medication was tested for 8 weeks. Showed excellent safety, got approved for short-term use. Now millions take it for years, decades, way beyond what was tested. And the long-term effects, magnesium depletion, AFib, bone fractures, kidney disease, weren't discovered until after millions of people had been taking it long-term, after the damage was done. This is the system. This is how it works, or doesn't work. Medications tested in healthy, middle-aged people, approved based on short-term studies, then prescribed to elderly patients long-term. And when complications arise, doctors blame aging, blame other health conditions, never blame the medication, because the medication is safe. The FDA approved it. The guidelines recommend it. It must be safe. Except it's not. Not for seniors. Not long-term. Now here are the 7 medications, the ones I've been building to, the ones destroying hearts right now in millions of seniors. Pay attention. This could save your life. Number 1, NSAIDs, Non-Steroidal Anti-Inflammatory Drugs, Ibuprofen, Naproxen, Diclofenac, meloxicam. These are Williams medications. They cause fluid retention, increase blood pressure, increase cardiac workload, cause heart failure. The FDA has black box warnings, but they're still prescribed daily to millions of seniors for arthritis pain. Alternative, acetaminophen, topical creams, physical therapy. But not NSAIDs, not if you're over 65, not if you value your heart. Number 2, certain calcium channel blockers, specifically diltiazem and verapamil. These are Dorothy's medications. They block calcium channels in heart muscle, weaken contractions, cause dilated cardiomyopathy in susceptible patients, especially seniors, especially long-term use. Alternative, other blood pressure medications, ACE inhibitors, ARBs, thiazide diuretics, all safer for heart muscle. But many doctors still prescribe diltiazem and verapamil first line, and hearts are dying. Number 3, proton pump inhibitors, omeprazole, pantoprazole, lansoprazole, esomeprazole. These are James's medications. They block magnesium absorption, cause dangerous magnesium depletion, lead to atrial fibrillation, meant for short-term use, 4 to 8 weeks, but millions take them for years, indefinitely. Alternative, H2 blockers like famotidine, dietary changes, antacids as needed, reserve PPIs for short-term use only, and monitor magnesium if used long-term. Number 4. Thiazolidine diones, diabetes medications, pioglitazone, rosiglitazone. These cause fluid retention and heart failure, especially in patients over 65, especially those with existing heart disease. Black box warnings exist, but they're still prescribed. Alternative, other diabetes medications, metformin, GLP-1 agonists, SGLT2 inhibitors, all safer for the heart. Some even protect the heart, but thiazolidine diones destroy hearts. Number 5. Certain tricyclic antidepressants, amitriptyline, doxepin, nortriptyline. These affect heart rhythm, prolonged QT interval, can cause dangerous arrhythmias in seniors, especially those on other QT prolonging medications. Alternative, newer antidepressants, SSRIs, SNRIs, much safer cardiac profile. But tricyclics are still prescribed because they're cheap, and hearts are paying the price. Number 6. Dronedarone, a heart rhythm medication prescribed to prevent AFib. Ironically causes heart failure, worsens existing heart failure, has caused deaths, has black box warnings, should not be used in patients with heart failure, but gets prescribed anyway. Alternative, other rhythm control medications, rate control strategies. But dronedarone specifically is dangerous. Number 7. NSAIDs again. Yes, I'm listing them twice because they're that dangerous. They're that commonly prescribed. They're destroying that many hearts. And people don't understand the risk. They think, it's just ibuprofen, it's over the counter, how dangerous can it be? Very dangerous, deadly dangerous, heart failure dangerous, stroke dangerous, kidney failure dangerous. But people pop them like candy, and their organs pay the price. These 7 medications, all commonly prescribed, all destroying hearts, all preventable, all have safer alternatives. But you need to talk to your doctor. You cannot stop these medications on your own. Some require tapering. Some cause rebound if stopped suddenly. You need medical supervision. But here's what you can do right now, today. Go to your medicine cabinet. Write down every medication you take, every pill, every supplement, everything. Take that list to your doctor. Say, I want to review every medication for cardiac risks. Are there safer alternatives? Do I still need all of these? Can we reduce doses? Can we stop anything? If your doctor is defensive, find a new doctor. Your heart is worth protecting. Join our community, link below. Inside, over 800 seniors have reviewed their medications, switched to safer alternatives, documented the improvements. Patricia stopped her NSAID, heart failure symptoms resolved. Stephen switched from diltiazem to lisinopril, heart function improved. Susan stopped her PPI after 12 years, started magnesium, AFib episodes decreased. These are real people, real results. Next week's video reveals the blood tests you need to monitor if you're on any of these medications. The early warning signs that damage is starting. The specific markers that predict heart failure before symptoms appear. Subscribe now or you'll miss how to catch the damage early before it's irreversible. Share this video with everyone over 65. Everyone taking multiple medications. Everyone who trusts their doctor blindly. Doctors are human. They make mistakes. They miss things. They follow outdated protocols. You have to advocate for yourself. Question everything. Demand monitoring. Demand safer alternatives. Your heart is precious, irreplaceable. Once damaged, it doesn't fully recover. Protect it. Question every medication. Demand justification. Ask about alternatives. Monitor for damage. Your life depends on it. Thank you for watching. Review your medications today. Join the community. Subscribe for next week's monitoring protocol. and protect your heart before it's too late.